Okay, so the procedure question, it used to be the case that internists would do a lot of procedures. So you'd have like thoracentesis, to draw fluid out from behind the lung. Um, Realistically, in other procedures, obviously, but in hematology oncology, the one procedure that you have is a bone marrow biopsy, which you do a lot in training. Um, and but as a solid tumor oncologist, you don't really do that anymore. Most of the procedures in medicine are done by interventionalists or interventional radiology, and so it's probably better, frankly, and that's why it's changed. I trained in a way that was like everything was sort of in flux and it was changing and kind of moving in that direction. Yeah, and so I mean, medicine is not a procedural oriented specialty. If you like to work with your hands, if you're really, then obviously do that. Medicine is much more intellectual. It's about putting a picture together, understanding these parts of the disease, understanding the biology, understanding the people, all of that kind of stuff. Yeah, so with hematology oncology, there's a trend towards sort of very much subspecialization. And so that dictates what your practice is going to look like. For me, that's been lung and head and neck cancers. And so, you basically, the other funny thing about oncology, if you think about it, is like that diagnosis kind of has to be established first before they start seeing you. Sometimes you'll play a consultant role, like in the hospital, and you'll help the internist or the other doctors with the workup and say, yeah, we need to get this and this and this. And then, once that diagnosis is established, then they'll come and see you. And, there are a lot of decisions at play at that point. Like, do we have all the information we need? The big decision is going to be obviously what is the treatment that we're going to do. And then, you kind of move down the line. So you really what I like about oncology is you follow people very closely and you kind of have a sense of these different trajectories that are happening. And you're really putting together what you're seeing in the pathology, what you're seeing radiographically, with what's happening clinically with the patient. And those things, you could kind of predict how it's going to go, but sometimes it's a little discordant. And you could sort of layer in fact, the emotional aspect of it too. And yeah, I think it's what I like about oncology is that longitudinal aspect of it. I mean, there are other docs, let's say an ER doc or even a surgeon, is just kind of a, you get sort of a snapshot, but with more like, internal medicine and other fields as well, but you just get this longitudinal kind of thing. And hopefully the patient, will kind of, get better and you can follow them for years, right? And they become sort of more like a primary doc kind of role. Obviously that's not the case for everybody. And so some folks, it gets more and more complicated and you help them with things that are obviously really, really important. And, kind of helping the families, helping the patients kind of come together with end of life issues that are, a lot of oncology is palliative. And so it's really making those symptoms go away, seeing how we can treat the symptoms so that people can be functional and do what they need to do and be with their families. Yeah, and that's a huge part of it. And there's really like almost a covenant between, the doctor and the patient and the family in such a way, because, it's one of the things that people experience when they have cancer is the sense of now they're in just a totally different world, right? Their world has been sort of changed. And so it's very hard to kind of relate to other people who aren't having that same experience. So you help people and you can help them just with information. You can help them say, this, a lot of people kind of experience this and this and this. And so that's what I mean about the relationship is very close. And, and it should be a lot of trust. It should be, got to trust you got to trust your doctors, but you really have to trust your oncologists, right? To make those important decisions for you.